Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone. Welcome back to the Movement Driven Podcast. I'm Dara here with Dr. Greg today. How are you doing?
I'm well. How are you, Dara?
I'm doing good. I have the Zoomies today that we just established a little bit.
Just like your dog.
Yeah, no, seriously. Like yesterday was one of those just like hardcore ADD maxing, as the youths say these days. Just bouncing all over the place. So now my brain is like, okay, we can focus on one thing, and it's putting like all of that energy from yesterday bouncing around.
Well, we're gonna put it right into this podcast.
I love it. But today we're gonna start to switch things up a little bit as far as the podcast goes. We've been doing a lot of, just kind of chatting about some general physical therapy things, and kind of keeping it a little bit mainstream. But from now on, I think we're going to really try to dive into some more specific stuff so that we can provide some more knowledge for our audience. So today specifically, we're going to talk about back pain, specifically back pain, and then on why your MRI isn't telling the full story. Mm-hmm. So let's talk about that. Why do image findings come out extremely common in pain-free people as well?
Yeah, so I think that's the important point right there. Like the MRI or the imaging does not define you as a person, but it doesn't even define your injuries. So there's often times where in my career I've had patients, especially back when we used to work with insurance companies in my previous ventures, you'd be working with a patient for 4 weeks and they needed to do physical therapy for 4 weeks before the insurance company would approve an MRI. Mm-hmm. And so because they had in their mind that they needed an MRI this whole time and the doctor recommended it, even though in these 4 weeks they've done tremendous improvement, no longer in pain every day, most of their, activities of daily life are resumed, and now they just need to kind of resume to high level exercise and whatnot. They're feeling better cognitively, good attitude, all that kind of stuff. And then they get an MRI, and then MRI says, oh, you have a herniated disc, since we're talking about the low back. And they're like, oh my God, I have a herniated disc. I'm like, well, we told you we think it's a herniated disc 4 weeks ago. Yeah. This is what and so from my perspective, it's like, yeah, this is perfect because you're getting better. Mm-hmm. And it's exactly what we thought it was. So we were spot on with our assessment, prognosis, this is just confirming everything, peace of mind. Mm-hmm. And this is the way I'm thinking of it. But a patient sometimes goes, now that they see on paper in black and white that they have this specific thing going on, it can be scary. And then you start, everybody now, it used to be, oh, Dr. Google, now it's Dr. AI.
Yeah, Dr. Chat.
I went on ChatGPT, I went on Claude. Okay, what did ChatGPT say?
Right.
So we need to kind of take a step back and realize the MRI, from a multitude of reasons, is just part of this diagnostic puzzle. Mm-hmm. So when somebody comes to see me, the subjective history, meaning when I'm asking them questions for 10 to 15 minutes, that's probably 75% of my diagnosis. And I think a lot of patients don't realize that. But I am getting so much good information from when it hurts, how it feels when it hurts. Does it come back? What makes it better? What makes it worse? What type of movement? Is it worse when you're sitting still? Is it worse when you're exercising? All of these questions are painting the picture so that when I go and then start our movement assessment, I already have a top 2 or 3 things that I think it is. And now I'm able to go in and do specific tests and measures to confirm and rule in or out the things that I think it is.
Yeah, for
So
sure.
there's a big thought process going on there. And so the MRI is just an additional piece of, well, we have our subjective history, we have our strength measurements, our range of motion measurements, our movement quality, what is your balance like, coordination, all of these things that we're looking at. And then we have an MRI that tells us, here's what's going on from a black and white picture. Mm-hmm. But a black and white picture does not define the grayness that is human nature.
Sure.
When you go and get an MRI and you have a herniated disc, yeah, so what? So does everybody else.
I have too.
And we'll talk about that, I think, in some of the other things that we listed, that we talked about pre-show. But like, discs in my viewpoint, disc injuries are so common that when you tell me you have a disc, I'm like, just yeah, okay, what else you got to say?
You also have a finger.
It's like yeah, right, exactly. It's you have a disc and it got injured. Like, did you get a scratch on your skin in the last 40 years? Probably.
Yeah.
It's that kind of thing. Our body just breaks down and it heals. And God made us this way, and it's really cool.
Mm-hmm.
But sometimes injuries are a little bit rougher, or we don't get better as expected, and that's where somebody like me comes into the picture. But going back to my original point of, if you see something on the MRI, one, it can be scary, but it can just confirm what we already knew. But the other part of that is, even if it says disc injury or something, it doesn't mean that that's causing your pain. It is what it is. Mm-hmm. But I've had people go in for surgery for the disc herniation that they saw, and they fixed the disc herniation, and the pain didn't change one bit. Yeah. Not like, oh, it's pretty good, but I still have chronic pain because like they didn't get one little bit better.
Yeah.
I had an 18-year-old girl, this is earlier in my career. Gosh, I'm like 2 or 3 years. So this is like 8 years ago. She went in, before I had ever seen her, she'd already had bilateral labral repair in her hips. 2 separate surgeries, right versus left. And then she's coming to see me, a year post-op. So this is when she's like 16, she had these surgeries. Wow. So now she's a year and a half or so post-op. And she's saying it didn't help one bit. Not like, oh, I'm like 50% better, but it still hurts when I run and sprint and sport. No, like, I'm in pain all the time. Mm-hmm. Didn't change at all. So the doctor went in based off an MRI and did a labral surgery on a teenager on each hip. The first one didn't work, and they went in and did the second one, Dara. Yeah. Let's save that for another episode. I'll change. Okay. Anyway, we worked with her, and she got a lot better doing strength and range of motion and doing the things that we do. And it just shows you that if the doctor went on the MRI and he was wrong, and you put a child through 2 surgeries and 2 really tough rehabs. Yeah. I mean, these types of rehabs are like, you can't weight bear through your leg for 4 weeks. You can't move in very specific directions in fear of ripping the repaired tissue it's very strict. And this is a high school athlete who lost 2 years and probably didn't really play again, if I'm being honest. Yeah. So sorry to get off on my soapbox there, but back to your original question. The image findings are just a piece of the puzzle, and even in it, like the research will show you, they're not super specific or sensitive. If they were 100% accurate, then insurance would cover it for everyone.
For sure.
They don't. That tells you everything you need to know.
Yeah. Yeah. No, and that's such a good point, to talk about. And who knows if the herniated discs and bulging discs that I have were from this specific moment in my life. But I got in a car accident when I was 17. Mm-hmm. And then, had the MRIs and everything. And they showed like 2 herniated discs in my lower back and 3 in my neck, mm-hmm. which probably is why my neck bothers me so much. Yeah. But so I've never had surgery ever for those ailments. Right. I was very fortunate to have doctors that were like, hey, like, you're 17. What I want you to do is swim and do a lot of core exercising. Mm-hmm. And that was like what really helped me not have problems with my back and stuff. And what do you do when you're a teenager or you're in college for work? You serve. You're usually a waitress for the most part, and that's what I did a lot. Mm-hmm. So I had a lot of heavy trays that I was carrying on my side. But when I wasn't working, I was at the gym and I was swimming, so that it would help me kind of tighten the core a little bit and work on those muscles. And I've every once in a while, like I might, if I deadlift wrong, I know, whoop, that one was not a good one. You know what I mean? But I've never had to have surgery, and basically all I do is, just make sure you keep moving. And I mean, that's what we stand for hugely here, is like movement is medicine. Right,
exactly. And back to the point, I kind of alluded to these statistics earlier, but the statistics of like who or how prevalent is disc injury. Like, if you're 40, I think at 40 years old, it's something like 30 to 40% have disc injuries. Mm-hmm. At 50 years old, 40. So you're talking about half the population by middle age has disc injuries. Yeah. I think it's probably even more than that, if I'm being frank, from my experience and what I've seen. But to your point, I had my first disc injuries from workout injury in my low back and a fall off a longboard on college campus for my neck, and I'm confident that those are what caused my 2 disc herniations. And to your point, once you have these things, it is hard to stay pain-free forever.
Yeah.
Especially if you want to keep being active. But who's to say that you're re-injuring the same exact tissue?
Right.
Are these tissues a little more vulnerable, especially if you don't rehab the right way? For sure. But we use the analogy of like you get a cut on your skin, it really is the same thing. It's just some tissue inside got disrupted.
Yeah.
And sometimes it's a cut in the skin and it hurts because it's in a very sensitive tissue. Right. Much more sensitive than a paper cut on the worst part of the webbing of your finger. Like,
right.
Think of like the most sensitive tissues. I imagine the disc tissue is very sensitive.
Right.
And when you get a cut in there, which then allows the disc to begin the process of actually herniated. And to back up a little bit, if we take a disc, I've talked about this on other episodes, but the outer layer or the outer ring of the disc is a little more fibrous and tough in nature. And you have like more of like a gel-like substance on the inside. And a herniation is when the gel-like substance makes its way through a tear in the tissue called the annulus, and it can herniate outward. And you can then have things like press on nerves, and that's when we get things like sciatica. Mm-hmm. So these can be serious things, but for the most part, we all have bulging discs, which mean it hasn't completely herniated outside of that fibrous tissue, but it's bulging and kind of pressing. Mm-hmm. And that's what I think a lot of people feel when their back goes out. They have a disc injury, muscles go into spasm, and then it's like everything you do hurts because you're using muscles that are just in like Charlie horse kind of cramping posture. And so then people go and they're like, let me rest, let me lay down. And it's like, no, I get that's the first instinct, but I would say, I get that, but move as much as possible. Walk, because you need to get blood flow and relaxation to these tissues, because most of your pain is not the little cut on the annulus, and even though it's super sensitive, most of the pain is to the low back and every muscle in your deep core reacting to protect. And it's pulling on rib cage, and it's pulling on pelvic floor, and it's pulling on diaphragm, it's pulling on, and it's pulling every which way, and everything you do with even a deep breath hurts.
Yeah.
We have to relax the system. And so I say all this to say is like disc herniations, super common. Mm-hmm. Most people, if not everybody listening right now, has something going on in a disc in their body, and you've had it for a long time. And then you go to get an MRI and like, look, you have a disc herniation. It's like, well, how do you know I didn't get that 20 years ago?
Right. Yeah.
How do you know it's not a joint
fall in
pain?
the playground? Right. And
because muscle strains and joint disruptions and things don't necessarily show up on an MRI in the same way, but discs always do. Yeah. So again, it's just a piece of the puzzle. It gives us good information. I'm not saying it's invaluable, but to trust it as the end all be all MRI disc herniation, no, that's what it is. No. Yeah. That's just 10% of the puzzle.
Yeah, for sure. Yeah, so I always like to try to also speak to the person who maybe is the, anomaly that the MRIs are showing, that they need some kind of, invasive surgery or anything like that. Mm-hmm. When that happens, what would that typically look like, so that a person can say, oh, cool, I have herniated disc, but then their MRI is showing something maybe a little bit more than that. When is it maybe like, oh, maybe it is more than this, or, just for the person who might be the anomaly there.
I think there's definitely times when we see an MRI and it looks bad. Let's just be like, there's some like, oh man, how's this person walking? Right. This looks really bad. Like, it's pressing on nerves. It's pressing on spinal cord. How are they not having more symptoms? And I think that kind of just speaks to the kind of miraculousness of the body and healing process. Because I've seen my own low back imaging. I'm like, how am I not in more pain? Oh, that looks terrible. Like and by terrible, I say that in what's the word I'm looking for? In jest. I say that in jest because, again, looking terrible doesn't really mean anything in my book. But back to your question, sometimes you see an MRI, and then when you correspond that with the subjective reports of the patient and maybe the lack of conservative measures working, i.e. I've tried some injections or I've tried some good, solid physical therapy and rehab. I've tried decompression at the chiropractor. I've tried a good list of things. The MRI also looks like, oh, that doesn't look good. Your symptoms aren't getting better. And then that's when a surgeon steps in and is like, yes, it's time for surgery.
Yeah.
It's not like never get spine. Like, I hate some people that exaggerate. Like, never let a surgeon touch your spine.
Yeah.
Well, sorry. If you have a hernia disc so bad that it is pressing on nerves to the point where you no longer have feeling down your leg and can't move muscles, sometimes we need to go in and cut that little piece out and make you feel a ton better. Right. And that's the appropriate thing to do. Mm-hmm. And that could be, hey, we're not even going to try conservative therapy. This is that bad.
Yeah.
But that's based off of a complete picture of, again, the patient's subjective reports, their inability to function, as well as objective measures that we're looking at, i.e. strength, or you don't have sensation, or you can't move this pattern of muscles that corresponds to this specific nerve of where your herniation is. Like, doctors should be looking at these things very holistically and not just, oh, there's a herniation, let's go in and cut you.
Right.
No. If you're second guessing the doctor, by all means, always get second and third opinions. Yeah. I always say that. But once you get that second opinion, the second opinion agrees with the first, trust it.
Right.
You probably do need surgery. Yeah. And that's super scary, especially in the spine. I totally get it. But honestly, in that acute sense, it's usually more successful surgeries because we're just going and cleaning out something that just happened. And I keep going back to disc because I do think it is the most common thing that we see in the lumbar spine, and that's we're talking about low back today. But in terms of sometimes what I was saying, sometimes the more acute surgery is more successful because the chronic one is like, oh, well, we're trying to fix something where you've had pain for 10 years and you have all of these different factors feeding into the health of your system. And so the young, healthy person that just got a really bad disc herniation lifting heavy at the gym, that's a bad injury, but if we treat it right away, we should be good to go.
Yeah.
And so I guess the word of caution is when if your symptoms are on the more mild side and then the surgeon is making it seem to be way worse than your gut is saying, then get your second opinion.
Yeah.
But if you're in a lot of pain and you're not functioning well and other measures aren't working and the surgeon's like, I really think you need surgery, then you probably do.
Yeah. Awesome. Well, cool. Thanks, Dr. Greg. I think this is a good episode, giving some perspective on the people who, maybe do need it. And then, the average person who probably doesn't. But, I think that anybody out there in the Jacksonville area that is feeling like their MRI is unclear and doesn't make sense based off of how they're feeling, but they know that there's something there, that they should probably give us a call. And they can go to movementdriven.com. You can schedule a free 15-minute discovery call just to talk to Dr. Greg and see what's going on. And then come in for an eval. And if you've got, some MRIs that you've got an opinion on, but maybe you want a more, conservative opinion or things like that on it, come have an initial eval with us, and Dr. Greg can take a look at that. And any podcast listener who comes in for their first eval gets a $79 eval discounted rate. So thank you so much, Dr. Greg. I think this is an awesome episode, and we'll catch you guys on the next one.
See you guys.
Thanks for tuning in to the Movement Driven Podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.